This vlog is probably going to piss off a lot of hearing care professionals. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 244, and today I want to talk to you guys about the differences between audiologists and hearing instrument specialists. But before I do me a huge favor, click the like button. It really helps out the channel, and if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So why am I actually talking about this topic? Well, I've talked about this before, like way back in the day, about the differences between audiologists and hearing instrument specialists. Now, this tends to upset some people because it always comes across as though we're trying to say that one is better than the other, and typically because audiologists have more formal training with, hearing aids and a variety of other modalities inside of the world of audiology, that blanket statements get made about how it's just saying that audiologists are better than hearing instrument specialists. But let me give you guys a little bit of a background here. So when it comes down to the differences in terms of credentials between an audiologist or a hearing instrument specialist, audiologists have to either have a master's degree in audiology from back in the day, or they have to have a doctorate degree in audiology to actually get licensed today by today's standards. So, you're starting to see a lot of the master's level audiologists retire at this point. By no means are all of them retired at this point. But most of all of the new audiologists coming into the field have their doctorate. And so this requires that they go through 4 years of undergraduate university, and they're either going to a 3 or 4 year doctorate level program at a university as well before they graduate, get their license so they can start practicing. Now, audiologist encompasses everything from hearing aids, vestibular, auditory brainstem testing. There's a variety of different areas inside of audiology that you can choose to specialize in, or you can be more of a generalist and focus on all of them. When it comes to hearing instrument specialists, they either have to typically graduate high school or have a GED and do some shadowing or on-the-job training underneath another hearing instrument specialist, or they can go to an actual 2-year hearing instrument sciences training program, which a lot of them do. Then when you're done with that, you can actually get licensed. You typically have to spend some time working under a hearing instrument specialist to hone in your craft with hearing aids. But at the end of the day, once you get done with all of that training, you can apply for your own license and practice independently. So when you go and you compare those two, clearly the audiologists have more formal training, but you could make the argument that hearing instrument specialists have more on-the-job training before they actually get licensed, which is really nice. And they're not wasting, I don't say wasting, that comes across as being negative towards audiologists, but they're not spending a lot of time worrying about all the other ear-related things like vestibular and auditory brainstem testing and all of that other stuff. They are focused primarily on testing adults with hearing loss to fit them with hearing aids. That is literally their singular focus. Now, if I were to stop there, there would be some people out there who are saying, Cliff, you're just talking crap about hearing instrument specialists because they don't have as much formal training as a doctor of audiology. And that is not really what I'm saying. But, the reason that I'm talking about this right now is that, we had published a video on the channel comparing these different credentials and really asking the question, do you know who's fitting you with your hearing aids? And it could be a master's level audiologist, a doctorate level audiologist, or a hearing instrument specialist. And, the whole purpose of that video was to help people understand that there were differences between them, but at the end of the day, really the only thing that mattered is whether or not best practices were being followed by the hearing care professional that you're going to. Well, we also turn a lot of our longer form videos on the channel into shorter form videos, meaning we have these AI programs that will go into our longer form videos and they will pull out little clips from the longer form videos and post them as shorts on our different channels. And we had one recently that was pulling from one of Dr. Rachel Cook's videos, talking about the differences between audiologists and hearing instrument specialists. And it only pulled out the portions that were talking about the different credentials that each one of them had. And so you could go and watch that short form video and be like, seems like they're just saying that hearing instrument specialists aren't as good as audiologists when it comes to fitting someone with hearing aids. And I had a lot of people reach out. And then of course, there were posts about it on social media. A lot of hearing instrument specialists went and posted nasty things and all that. And honestly, I can't really blame them. part of me when I started seeing this, like, I'm gonna make a vlog video and I'm just gonna, tell everyone that they're stupid and that they don't have full context and all that. And then I was like, no, Cliff, you probably did mess up. You probably shouldn't have relied on a bot to go in and carve up a video that you did that has full context. It's like a news outlet, right? They tell you the little sound bites that they want you to hear, but they leave out the full context. That is not what I'm trying to do on this channel. And so I can totally understand that if someone were to go and watch the full-length video, that they would be like, oh, okay, they're really saying that there are differences between them in terms of education, on-the-job experience, credentials, whatever the case may be. But at the end of the day, the only thing that matters when you go to a hearing care professional is that you go to one who follows best practices. Now, you guys know me, I am 100% on board with the only thing that matters is if your hearing care professional follows best practices. Of course, you want them to do this in a person-centered care way so you actually understand what they're doing with you. But, it doesn't require that you have a doctorate in audiology to follow best practices. It doesn't require that you have to have a master's level in audiology to follow best practices. Literally everybody who touches a hearing aid as a professional should be following best practices. And that is really the thing that determines whether or not, in my mind, you're good. So, a lot of the arguments back and forth, and this animosity between audiologists and hearing instrument specialists is kind of old at this point, but it goes like way back. I mean, back to the time when audiologists were not even fitting hearing aids, and then audiologists started including hearing aid dispensing inside of their scope of practice. So, like, audiologists, in a way, I guess, were kind of treading on hearing instrument specialists, specialty. And so like I said, it goes way back. There's animosity between both sides, and you typically have people be like, oh yeah, well, I know a lot of audiologists who aren't very good. And then audiologists are like, oh yeah, well, I know a lot of hearing instrument specialists that aren't very good. And at the end of the day, like, there's good and bad on both sides. I mean, there's audiologists who do not take their job seriously, meaning they don't follow comprehensive best practices, or the place that they work for doesn't let them follow best practices. And then there's hearing instrument specialists that don't follow best practices when they're treating patients. And so, it drives me crazy. Like, I really don't care whether or not you have your audiology license or a hearing instrument specialist license. It doesn't matter as long as you're making sure that your treatment outcomes are fantastic. And, I don't honestly think that you can go and just look whether or not someone has a particular credential and determine whether or not they're actually good or not. The thing that you can look at to see, like, okay, is it more likely than not that I'm going to get an exceptional treatment outcome from this individual, is whether or not they're doing all of the procedures which are considered best practices, and are they doing all of these procedures the right way? Now, I am so adamant that the credential between audiologists and hearing instrument specialists doesn't matter, that when I started my Hearing Up provider network, I allowed both audiologists and hearing instrument specialists to apply to the program. The only restrictions that I had in terms of audiologists is that they had to be a doctorate level audiologist or a master's level audiologist and licensed in their state as such. And for hearing instrument specialists, they either had to be board certified hearing instrument specialists, or they had to go to a 2-year certification program. And this happens up a lot in Canada, where they have these 2-year programs. These programs are fantastic. You basically spend 2 years straight focusing on nothing other than testing hearing loss and treating hearing loss with hearing aids. On top of that, I made a choice very early in my days of creating YouTube content to make sure that I didn't say, make sure you go to an audiologist. I always said, go to a hearing care professional, which is inclusive terminology for both doctorate level audiologists, master's level audiologists, and hearing instrument specialists all the same. So just know that if you're a hearing instrument specialist watching this video, just know that I do not think that you are very good if you don't follow best practices. I actually think that it is a violation of your ethical code of conduct to not follow best practices. On top of that, if you're an audiologist watching this video, I don't think that you're very good, unless you follow best practices, which again is in violation of your ethical code of conduct. You should be doing everything in your power to maximize your patient's treatment outcomes, specifically when it comes to treating someone with hearing aids. So yes, I still realize that my approach to who is good and who is not good hinges a lot on this idea of best practices, and there's probably a lot of people out there who hate me for spreading that message, particularly in the professional community, if you either believe that they're not important or if your employer doesn't let you do them, because I'm basically calling you bad at your job. And you know what? It is what it is. There's probably things that I'm not very good at either, but one thing that I am very good at is making sure that not just myself, but every single hearing care professional inside of my clinic also follows comprehensive best practices to maximize the performance of our patients' outcomes.